you a little bit about Good Sam for those of you who may not know. So, Good Samaritan of Gwinnett is very different from the other Good Sams. I know people have said, well, there's a Good Sam Atlanta, there's a Good Sam Cobb, there's a Good Sam Jasper. And we just like to say we're all friends, but we operate completely independently of one another. So those models are very different from our model. Our model is a self-pay model, right? So we don't do a sliding scale. It's strictly self-pay. The prices are heavily discounted from what it would cost in a regular primary or dental care setting. So that's really one of the things that distinguishes us from a lot of the other nonprofits that are out there. And so we're very, very grateful to do these lunch and learns. This is our second one. And we do plan on doing them periodically around relevant topics that we have either heard from our patients, heard from our providers, or heard from the community. So you guys get to be part of really the inaugural sessions of these as we plan to kind of keep this an area of focus for us as we progress in the idea that we want care for the uninsured to be preventative, right? Not always urgent. And a lot of chronic illness that happens comes as a result of lack of prevention in some cases. So you're going to see Good Sam Gwinnett be an advocate for that. And so that's why we're doing these sessions to let you know about the services that we offer, as well as some things that, folks can do to keep themselves healthy. So I am pleased to present Caitlin. Caitlin is one of our providers here at Good Sam, and she is really going to be running the session today. And I love to let our subject matter experts lead these because I can stand here and read slides, but Caitlin and our providers are the ones that do the work, do the hands-on work. So last time we had Erin, who was one of our RNs, present, and this month is going to be Caitlin. So I'm going to turn it over to her, and I'm also going to ask Caitlin to introduce herself and to also give us her why and her history with Good Sam. So Caitlin, I'm going to turn it over to you.
Yeah, thanks, Shameka. I'm just really grateful to be here. Thank you for giving me the opportunity to share. So I first learned about Good Samaritan in 2019 as a student, master's student at University of North Georgia. One of my professors had kind of introduced me to the organization to think about potentially using it as a clinical site, not knowing that the next year was going to be 2020. So I came in January of 2020 and met with Laura Martino, who is the director of clinical operations, set everything up to start in the summer of 2020. And then, of course, everything else transpired. Folks began to shut their doors down to students, was really having a hard time getting clinical hours, and then reached out and was just inquiring whether or not I was going to be able to complete my rotation here. And it was, no questions asked. Yes, come and learn. And not only was I able to come and learn, but I was able to come and be nurtured and as a provider, and just really be able to learn about caring for folks who don't have insurance. And so 2019 or 2020, I started as a student, and then 2021 graduated and started as a full-time nurse practitioner in October. And I'm excited this year, having moved into some of the operations and helping out with that. I've always viewed Good Samaritan as just, an extension, an arm of God's love, God's mercy, and his compassion towards individuals. And I just hope that we can continue just to continue moving forward with that goal in mind of preventing, disease, but also providing that spiritual care and providing what I hope is an extension of God's love and mercy and compassion towards our folks that walk in the doors. So Evelyn, if you have our slides ready, we can kind of move forward, and I'm just gonna really informally go through some topics regarding us upper respiratory illness, and how we approach that in caring for folks who don't have insurance, and what our goals and what our strategies are. So, like Evelyn said, this is very, very informal. So, at any point, if you have a question, feel free to put that in the chat. I'll try to jump in and answer those, and we'll kind of move forward. But so if we'll move forward, we're going to kind of talk about some of the biggest upper respiratory illnesses that we see here at Good Sam, Evelyn, so we can move on to the next one. So obviously flu, we got flu A and flu B. So you can see, 2022 to 2023 numbers were about 31 million people affected. And then obviously common cold, most folks will get about 2 to 3 of those per year. COVID-19, it's been around, it's going to be around for much, much longer. And then we have strep throat, and then RSV, respiratory syncytial virus. So all of these are common conditions that we see, that we treat, and it can be hard as patients try to differentiate, is this something serious, or is this something just like the common cold, and what do I need to do about it? So thinking through what this year is going to look like, Evelyn, if we'll move forward, we'll talk about what the CDC is predicting for 2024 to 2025. So, obviously, as we try to predict and try to make an outlook, this is got a lot of different factors involved. You've got things including, vaccine uptake. What's that going to look like? Is the community going to uptake vaccines as we are, trying to get them out there? Are there going to be new variants of flu, new variants of COVID? So we're constantly monitoring that, the Department of Public Health and what's coming. So CDC right now is predicting that the 2024 to 2025 season is going to be about the same as last year, combined the hospitalizations due to COVID, flu, and RSV. They're predicting that it's going to be similar to or less than last year. So we're hoping that that's going to remain true. And especially with, the 2024 to 2025 COVID vaccine that came out and RSV vaccines that are coming out. Those are really exciting tools that we have as clinicians to be able to push forward and hopefully keep this cold and flu season similar to, or hopefully not as severe as last year. So as Shameka mentioned, we've been, really focused on prevention and what we can do to keep folks well. And as much as I love to see my patients, I really, don't want them to have to come in here sick. So how can we prevent them from becoming ill? So we can move forward, Evelyn. We'll talk about some prevention strategies that we like to try to teach to our patients. Obviously, one of the biggest ones is hand washing. So a big frequently asked question that I get from patients is, do I hand wash or do I use my hand sanitizer? What's better? As a general rule of thumb, we're going to recommend hand washing is better than your alcohol-based hand sanitizer. That's a great option if you don't have anything else available, and it's a great option. But CDC and a lot of other folks will also always recommend that hand washing is the best. If you don't have anything else available, then you've got your alcohol-based hand sanitizer there. So other things that we try to, recommend, making sure folks, if they're sneezing, they're coughing, that they're doing that into their arm, never their hands. You can use a tissue if you need to, but always washing your hands after you do that. So kind of a fun fact as well is we can, of course, transfer any germs from our hands to our face when we touch our face. And I was looking through this and I was amazed that according to some data, that about 23 times per hour is what it's estimated that we all touch our face. So especially females, as we push our hair back or scratching our nose, adjusting our glasses, 23 times per hour that we're touching our face, and how now I'm going to be mindful of that and try to keep myself well by not touching my face. Big tool that we also like to recommend to our patients is that there are home tests available at pharmacies for low cost. We also have some resources that we're going to share in just a minute about how folks can get free home tests, COVID-19 home test kits to their home, and that might save them a visit. If their symptoms are mild and they test positive for COVID, they know what it is, then they might be able to self-isolate at home and get through that illness without needing to pay or to come in for a visit. But we're always here if they have questions about that diagnosis and how they're going to be treated. Also have vaccinations. We do have the 2024 to 2025 COVID vaccine in stock and available for all of our patients. So as folks are coming in for their diabetes checkups, their well visits, we're really trying to recommend that everybody be vaccinated. We have the flu vaccine. That stock is kind of variant, so always just call and ask us if that stock is available. And then we have the RSV vaccine. We don't have it in stock here at this time, but I know that there are a lot of pharmacies in different areas that you can get that RSV vaccine. And that's usually for our children and our adults over in their 60s and 70s. So we kind of move on forward. The CDC gives us just some really great tools. This is just one example. If you are in healthcare office, if you're in any type of setting where you have a lot of interaction with the public, CDC always has these great handouts, these great visual tools. This is one of them to talk about prevention, and then also talking about those questions that we probably get from staff members all the time. And that's, well, I'm sick. Can I come back to work or not? And they always have these great tools available. And these links are all available to you if you need them. All right. And then moving forward, I have a list of all of the COVID testing resources. So the HHS.gov and the USPS.gov, those are all resources that are available to go online and order that test to be shipped to your home for free. And then we have free COVID-19 testing sites that are available. You can go on, put your zip code in, put your city in, and they can direct you to where you can go get a test for free. And then moving along. So these are a lot of the common symptoms that we will get here. And that is, fever, chills, fatigue, the cough, runny nose. I don't feel like eating, sore throat, vomiting. And it can be really hard for patients to distinguish, like I said at the beginning, is this something serious? Is this something that I need to go to the doctor for? Or is this something that I can manage at home? So as a general kind of rule, I do have a list coming up about things that are emergencies, things that you don't want to wait for. But here at Good Sam, we have a lot of resources available to treat folks with any of these upper respiratory type symptoms, and we're happy to do so and help you kind of differentiate, is this common cold versus COVID versus flu, versus something more serious. So we move forward, Evelyn, we'll talk about when to go to the emergency room, or when might I need to go to an urgent care versus waiting for my appointment at the primary care office or at Good Sam. And that is if you lose consciousness, if someone passes out, if they have an extremely high fever, greater than 103, they're having difficulty breathing, rapid breathing. Those are always reasons that you would want to go on in and be seen immediately, or inability to swallow A lot of times patients will say that they're having difficulty swallowing, and that usually means that it hurts. But if they actually cannot get food down, or they're having difficulties with their airway, that's always a reason to call 911 or go to the emergency room. Right. And so this is what we have affectionately named our SPA, and that stands for Screening Prevention Annex. So this is when our patients enter the front door, they are greeted by a staff member and screened for questions of upper respiratory illnesses or any type of contagious illness. And if they screen positive, then we have this beautiful facility available to get them seen, to get them treated without exposure to any of our healthy or well patients. So in this kind of area, this is our addition kind of in the front of our building. We have a full exam room. We have testing available for COVID, flu, and strep. We'll provide a lot of our vaccines here, and then provide that medical evaluation to help differentiate between those COVID, flu, RSV, common cold, strep throat, and trying to help you figure out what treatment's necessary and what the next steps are. So our treatment, especially trying to keep our focus on folks that don't have insurance, people who are paying out of pocket for all of their care and all of their services. We have to keep our resources in mind and be very mindful of what we are prescribing and how we're going to treat. So for your common cold, for a lot of your viral infections, we're going to recommend supportive care. And we have a list of things that we'll recommend for folks to do: resting, fluids, your cool mist humidifiers, saline nasal sprays, and things of that nature. If we're thinking about antiviral medications for COVID and flu infections, those usually have a shorter window of being able to treat. So usually within the first, 48 to 72 hours are the best times to start those medications. So if you think that you have COVID, flu, we would like to see you within that first 2 to 3 days to be able to help get folks on antiviral medications if they have indications for those, which are usually other like conditions like diabetes, high blood pressure, asthma. You're definitely somebody that would qualify for antiviral medications. Obviously there's Tamiflu for the flu, and then there's Paxlovid and other antiviral medications available for COVID-19. We have patient assistance program through Pfizer to help get Paxlovid for folks who are uninsured. So that's a quick, easy tool that we can help our patients walk through that process, so that way they can get their medications from one of the big pharmacies through that emergency use authorization that the government's given us, to be able to get that medication, usually at no cost to the patient. That used to be a much easier process. We used to be able to just send our folks straight on to the pharmacy, and those pharmacies had a stock of emergency use authorization medications for folks who did not have insurance. That's no longer the case. So we kind of have to walk the patients through this process to be able to get that medication at a low cost. And then obviously, if we're going to be using antibiotics for folks, we have to keep in mind what we're prescribing, and especially with our pediatric and our children. If we're going to be prescribing a liquid or oral suspension medications, those can sometimes get very costly depending on the medication, and just making sure that we've called around to the pharmacies, we're using our GoodRx coupons, and figuring out what's going to be the best treatment that the patient can afford. And usually those antibiotic treatments are going to only be indicated if you have strep throat, if the symptoms have been present for greater than 10 days and there's signs of those bacterial infections, signs of pneumonia or bacterial sinusitis after that 10 days. All right. So then moving on, Evelyn, just a quick other really frequently asked question that I get is how and when do I return to work or school? We are happy to provide school excuse and work excuse for the estimated period of time that we think you're going to be out of school and work. And this is kind of the newer updated respiratory virus guidance that's going to hold true probably through this 2024 to 2025 year. And that's that you have to be fever free for 24 hours without using Tylenol and ibuprofen or any other fever reducing medication. And that you have to have an improvement in your symptoms, that cough, the sneeze, the runny nose, that has to all be improving. So both of those things need to be true for someone to be able to return to work or school, as well as the few days following your return to work and school, you really want to be very mindful and using some kind of prevention strategies so that you don't get other people sick. And some of those things are, potentially wearing a mask, washing your hands really well, again, sneezing into your elbow, trying to be mindful that you keep distance from other people if you do still have some of those viral symptoms going on. So at this time, I'm going to turn it back over to Shameka and see if we have any other additional questions, or happy to input on anything that anybody's curious about.
I think we have a couple more slides on there. If you would show those on the screen, because we are going to take questions, and then I'm also going to ask some questions that I know are frequently asked by some of the folks who join our clinics or come to our clinics. So before we get going with the Q&A, I just wanted to let you guys see the services that we do offer. We have obviously primary care, but we also do specialty care, meaning that we do have volunteer physicians that come in and are able to assist on site. And all of that would be determined by the provider, whether or not this is something that one of our specialists can handle, or if it's something that we would need to refer you out for. We do a ton of chronic care management, so diabetes management, hypertension, a lot of chronic care illness. So I think our provider team does an outstanding job of helping to try to manage those on site as well. And then we also offer a full service dental clinic. A lot of people don't know that about us. We treat thousands of patients each year in our dental offices in both clinics. So, and we do general dentistry, but we also do root canals, crowns, and it is very, very affordable compared to what you will see in primary dental care. And then we also offer biblical counseling. So that's just an overview of the many different services that we provide. But I did want to open it up to see if anyone has any questions for Caitlin. I know we don't have any in the chat, but does anyone have any want to come? Oh, we just have one from Crystal. So Evelyn, you want to read that one? Oh, you're muted like I was earlier.
Oh, sorry. Sure. Does your clinic see much hesitation or concerns with vaccination? And if so, how is this being handled to encourage or increase vaccination?
I would say we do see a fair amount of vaccine hesitation. And that's when, as a provider, as a clinician, we really have to stop and take the time to educate the patients. And if I'm just going to sit down and have an open and honest conversation, and usually hearing them out to hear exactly what their specific concern is. And then kind of going through some of the data with them, the safety profiles. We will talk about, like I said, their specific concerns, maybe provide them some written literature, things to go home and think about. Always, if I'm recommending a vaccine, it's going to be easiest for them to get it at that same visit, that same day. But for some people who have a lot of hesitation, they might just need that day or two to come back and think about it. And then they'll feel ready to receive the vaccine at that time. And then kind of going through, like I said, their specific concern, and hearing them out, because it's usually not just a broad vaccine hesitation. It's usually one specific thing that they are worried about. That might be a side effect. That might be, is it going to affect this certain medical condition that I have? Is it going to interact with the medication that I take? And just showing them some data about that so that they're informed and they can make an informed decision about their health and their body.
Awesome. Thank you, Crystal, for the question. Any other questions?
Yep. We have another one here from Eslin. What is the charge for a client to be seen for dental care? So, Eslin, good question. So the initial cost for a dental examination is $125. And I say that, and people go, wow, that feels very much like a normal dental clinic. And I can actually go places and get that for cheaper. But I will tell you, our initial exam, we do everything that a regular dentist office would do. But what you're going to see the savings, the biggest difference is in the treatment plan. So recently we've had patients bring us treatment plans, and I kid you not, basically with most of our patients, they are getting 5-figure treatment plans, where they are coming in and spending anywhere from $10,000 to $15,000 on dental care, whereas we will more than likely be able to do that work for less than a third. Now, I will tell you that we don't do implants, we don't do cosmetic dentistry, but the differences in what we charge and what the market charges is very significant. So that is where you see the difference in cost. And then if you actually have one tooth that's giving you a problem, then the initial examination is only $50. And then we have another question from Pooja.
Are there any new COVID vaccines that have come out recently that patients may not be aware about?
Great question. Yeah, so there is the 2024 to 2025 vaccine that has been made specifically to try to pinpoint those variants that we think are going to be out and about this coming season. So it is a really good tool that we'll have to be able to use for patients that will hopefully, and the communities, that kind of includes all of us, trying to get as many people as possible vaccinated with that one. That way we can hopefully decrease the spread of those newer variants.
And so, Caitlin, while we're waiting for other questions to pop up, I want to ask you, so talk a little bit about, because a lot of times with uninsured patients, they may not know where to go, especially if you're unfamiliar with the U.S. healthcare system. So I want you to kind of explain how you and the other providers, our recent triage process, and what that looks like for you guys when we tell you what are some of the things that you question if a person thinks they might have chest issues or breathing issues.
Yeah, so we have a lot of folks who are trying to establish primary care for a multitude of different reasons. And so if someone calls in and they are experiencing some symptoms that might be concerning, we as a provider team might want to make sure that we're the right place for them to be evaluated. So if if someone is having severe chest pain, difficulty breathing, or stroke signs or symptoms where they've, lost function, one side of their body, difficulty speaking, slurring speech, those are all reasons we would refer to the emergency room 100% of the time. So other things that we would, want to help people with is, establishing care for their diabetes, their high blood pressure management. We would want to see folks who are trying to get those conditions under control and better management.
Awesome.
Thank you.
We have a question here from William. What are some of the specialty services your providers offer?
So we have a few volunteer specialists who provide their time with us. And so the biggest thing is that if someone who is interested in receiving some specialty care at Good Samaritan, the biggest thing that they need to know is that they would have to come in and have a appointment with a primary care provider first. So that way we can make sure that their issue is appropriate for our particular volunteer specialist. Now, as I mentioned, these are volunteers, so their time and the schedule is dependent upon what they're able to give us, and we are so grateful for those that who provide their time and resources to us. Right now, we have some folks who help us out with neurology. We have some folks who will help us out with podiatry, cardiology. And our gynecology services are on hold at the moment, but hopefully maybe getting that back going soon. And then starting to have some volunteer provider with psychiatry. So we're going to have more forthcoming on that, but those are all kind of limited at this point to our current patients. And if someone comes in, they would need to be screened by the primary care providers first. But great question.
And while we're waiting for more questions to pop up in the chat, Caitlin, can you talk about kind of like how our patient navigation works? I know a lot of folks come to us because, again, we mentioned they don't know where to go, but once they've seen you, can you talk a little bit about how we do that for them, how we provide that service?
Yeah, that's a great question, Shameka, because a lot of times our patients will come, especially our new patients, are sometimes referrals from hospitals, folks that have been discharged from the emergency room, and they might have gotten multiple referrals to different specialists, been started on a lot of new medications, and now they're what's next. And so a good kind of metaphor we like to use for ourselves as a primary care facility is that we are kind of the quarterback for your team here. And we're going to try to help navigate you to the specialist that you need, oversight of your medications, as well as we have a care coordinator available to help us get folks to the right specialist that they need. And then just managing after those specialist visits, reviewing the records, helping patients understand their treatment plan and what the next steps are.
That's awesome. And the reason why I wanted Caitlin to bring that up is we do see that quite a bit across all of our providers is if you are thinking of referring someone from your network or facility to Good Sam, I would definitely recommend, if they're a brand new patient, if it's not, generic primary care, that you call and make sure that the patient does a triage with the provider, or basically just questions, what should I do? Is this something that we can handle? Because, we certainly don't want to take money from folks if we're not the ones that can help them. So we will always try to find out to make sure if it's something that we can help them with. And we can do a lot. We manage a lot of chronic conditions on site for patients that are very ill, and we try to do that at the top of our scope. so that we can provide that care, because it is very difficult to get some of our patients to go to their referral appointments. I mean, we're not going to make this all rainbow and roses. It's hard. And I admire Caitlin and our providers, because some of our patients are very, very complex and need a lot of care. And they are most of the time doing this through interpreters. So if you can imagine a complex patient where English might be a second language, and having to navigate that care plan, they do a wonderful job. And Rick, you had a question. You mentioned that you work with uninsured, but can you also work with underinsured? Yes, that's a very good question. We have had a lot of new healthcare plans out there have over the last couple of years, and we've seen people come in with $10,000 deductibles. Not a joke, right? $10,000 deductible. So for the purpose of primary care, they are underinsured, right? So we will see those patients, and we have had Medicare and Medicaid patients, which we don't take Medicare and Medicaid, but they don't have dental insurance on their Medicare or Medicaid. So we will see those patients and treat those patients, because for the purpose of that visit, they are uninsured. So what used to be a very kind of black and white type thing, either you're insured or uninsured, has turned very gray. And then we also have patients who come in and they don't know what kind of insurance they have. You know, it's some form that they've signed up for, and they don't know the deductible, they don't know what's covered. It's very predatory, the way a lot of these insurance companies are going after folks, because they have no idea how to use it. So, you know, then the question becomes, well, should we see the patient? Because if they need specialty care, their insurance is going to then turn around and ask them to go to one of their providers, right? So we really, truly have to navigate it and make sure it's one of those things that we can manage and help the patient kind of walk through based on their situation. So that's a very good question. It does, I will say it varies based on the patient, the individual patient.
Yeah, Shameka, I was gonna make another point back to your thought on the patients needing specialty management. Like you mentioned, the provider team here is always willing to review a case and make a recommendation on whether or not an appointment is appropriate. So never feel that calling and being stuck with an appointment and not knowing if it's going to be right or not. We are always willing to call someone and make sure that our resources are appropriate, and that we are a good fit. I believe you're muted again, Shameka.
Thank you. I was trying to keep that beeping noise from coming in. And is there anything, Caitlin, that they should bring with them to an appointment? Maybe for that first appointment, do you want to give the audience an opportunity to know what that would look like?
I have a list of things that I would love for patients to bring me. So if I have a patient that brings me a sack full of medications, I am very happy, because they know what they're taking, and they bring it all. They bring the medication bottles and all, and I love that. So always encourage folks to bring all of their medications, over the counter medications, vitamins, supplements, whatever they are taking, in a bag with them. Also, for people who are having issues with their blood pressure, blood sugar, their diabetes might be uncontrolled, bringing a log of their home blood sugars, of their home blood pressures, is going to be helpful. If they have a list of their family history, if they have a list of past surgeries that they've had, past hospitalizations, any medical records that they have, and the list of any specialists that they see. Those are all very helpful from a clinical perspective of making sure the care plan is appropriate, and then the next steps of their treatment process are carried out in an effective and efficient way. And it saves so much time and money for the patient to bring all of that with them.
That's a very good point. And as we get ready to wrap it, again, I do encourage more questions, but I haven't seen any pop in the chat. I just want to add that Good Sam, uninsured patients, that's our primary business. That's what we do. And I think Caitlin made a very good point at the very beginning is because we are dealing with uninsured patients, regardless of income, we do try to find the most economical way possible to treat our patients. And whereas, a lot of times, unless you go to another charitable clinic, it's the opposite. There's a lot of things being thrown at the patient. It costs a lot of money, but we understand that money is an issue, but also time. Most of our patients work. They can't take time off from work. When they do take time off from work, they miss a paycheck or they miss out on hours. So because uninsured patients are what we exclusively handle, we feel like all of our treatment and everything that we offer is designed for the patient. And then the time that we give our providers to spend in these appointments, because they can get long, they can get lengthy, especially when you're trying to determine treatment options. So I just do encourage you that if you know of someone who is in need of care, especially if they have a chronic illness, that this is one place where they can go and not feel like they're kind of on the other end where everybody has insurance and they don't. So that's really kind of like our bread and butter and what we do.
Yeah,
So go ahead.
Sorry.
Sorry.
I was going to mention one thing that I love is that there's never going to be a surprise fee. We're not going to do something and then say, oh, well, here's, a $50 bill because we did this. Our patients always know what labs are going to cost before we do them, what a flu, COVID, strep test is going to cost before it's completed. There's not going to be any surprise billing or any surprise fees. They would know everything prior to receiving that care or that testing.
Okay, we have a question from Alice. What are the different forms of identification? Whoa. Caitlin is laughing because we laugh because we see a little bit of everything. We see ID from other countries. We see library cards, Sam's Club cards. Basically, as long as it has your picture on it and we can identify you in the photo, that we accept that. It does not have to be a state issued ID. We just obviously, because names can be very similar, we need a photo ID with a name. It would be great if it had a date of birth on there, but most times we get just a name and a picture is fine. For children, we do ask for the children's situation has gotten a little bit different too. I will tell you this. We typically ask for the parent to bring in a birth certificate for the child if they can, just to kind of establish, the relationship. But we have seen an influx of unaccompanied minors. So we have had to, again, treat those as a case by case basis based on the situation of the child. What we are hearing is a lot of places are turning caregivers and kids away because the relationship can't be established between the adult and the child. And we have to do a little digging and we can ask questions, but ultimately we try to do what's best for the patient. And as long as we can determine what the relationship is, we will treat the child as well. We treat, Caitlin, why don't you tell us about the age range and the type of illness? I don't want to speak incorrectly.
Yeah. So there's really no cap on the age height, like how old you need to be. But usually we'll treat folks or infants that are 6 months and above. We have treated some newborns before. So again, kind of like Shameka said, it's sometimes case by case, but most all of our providers here are trained to treat infants to, we have some folks that are over 100 years old.
Wow, I didn't know that. We've got patients over 100. Interesting. Okay. And we have a question from Aslan. Do you work with homeless community? We do have patients that are homeless. Depends on the definition of homeless. Again, we would ask that the patient be able to present some form of ID when they come in, if they do have access to that. If they're being referred by a group, like let's say you're an organization that we have a relationship with, and you want to sponsor, your patients being seen, we do agreements like that all the time. But we have treated homeless patients. They are treated just like any other patient. We are, again, we just like to tell people that we're not a free clinic. So we are sometimes able to offer help for those patients that really can't afford it on a case-by-case basis and depending what the illness is. But our doors are open to everybody. Thank you for that question.
Shameka, also to add to like that first appointment, that first appointment for a new patient, they bring in their photo ID, and we also ask for proof of income. I know when I'm out in the community doing different community outreach events, I've met folks that are, just they have different scenarios. Can you speak into like what different forms of income we accept, especially if for some reason they cannot get any type of form of income, maybe they're living at home and their son or daughter support them?
Yeah, so good point, Evelyn. Thank you for that question. So we do require proof of income. We do not have income requirements, though, and I like to make that distinction. And the reason why we do proof of income is because we have to give that information to Gwinnett County because we have received HUD funding in the past. So they require us to collect that data. And so proof of income, again, comes in many different forms. It can be a check stub, it can be a W-2, it can be a bank statement, it can be an affidavit saying, we might get you to sign that saying, I don't work, I have no form of income. We have gotten letters from employers, if we have employers that maybe work for employees that work for maybe a small business, they might get their boss to write a letter saying, this person works for me and they make $200 a week, or whatever the case may be. And again, we keep that for record keeping purposes, not as a means to disqualify someone from coming to the clinic. But typically on the first visit, if the person happens to forget, or if it's an emergency visit, we will tell you to bring it on your second visit. After the third visit, we ask that you not make another appointment until you give us that. So that way we can have it on file for you. And then we update that once per year. But again, we understand that the situations vary. So if a person is living at home and they're being supported by mom, we'll just get you to sign a statement saying that. If they don't have a job, we'll get you a statement, so we try to eliminate as many barriers to care as we can. We don't need a utility bill. We don't want you to live in a certain zip code. We don't require any of that. We serve people from as far away as another state. They come into town and they visit. We've treated relatives from around the world as they come and visit their parents or friends or kids. So we've got a very, very large and open policy about not turning folks away, and we do try to work with everybody. And then we have a question about where our facility is located. And Evelyn, I'm going to ask that maybe you pop that screen back up. Thank you. So these are the addresses of our two locations. We have our west location, which is located in downtown Norcross. And then our east location, which is undergoing some construction right now. So right now they're dental only, but they will switch back to medical and dental early next year. So this is where our clinics are located and where you can find us if you need us. And Crystal, do you help patients with patient assistant programs beyond Paxlovid? Yes. We have a very robust PAP offering. And Caitlin's smiling. We know which meds are on PAP, and we definitely try to, when it is appropriate, prescribe those medications. We've helped thousands of patients over the years save significant amounts of money by offering PAP. We also have a dispensary where we have a technician that works, and her sole responsibility is helping with PAP documentation.
Crystal, not sure if you're medical or healthcare. I can't remember what your title was, but we use the PAP programs through drug companies, often mostly for type 2 diabetes medications like GLP-1 medications, SGLT2 medications. We use it frequently for asthma medications, and sometimes like Repatha for hyperlipidemia. So there are a lot of different treatment options available. We try to stay as current as we can on the different requirements for each of those medications and each of the applications.
Awesome. 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 Well, we are 5 minutes to time, and I'm going to ask Evelyn if you would pop up our social media handles.
Yeah.
Um, so I would love for everyone to take a minute if you are interested in learning more about Good Sam to please follow us on our social media apps. We post frequently. Evelyn does a fantastic job of keeping everything updated, and we try to put new and interesting content out very frequently for our followers. So if you are inclined to do so, please follow us on social media. And besides that, I just want to thank everybody for personally taking time out of their day to, come and hear more about how we help uninsured patients.